Let's talk about positioning when breastfeeding. Hi, I'm Sophie. I'm one of the nurses at Serenity Baby Clinic. So one of the things that's really important when you're feeding is to make sure that you've got the positioning of your baby right to ensure that the feeding is comfortable and sustainable for you both. There are a number of positions that you can hold your baby in, but the technique for positioning is the same no matter which position you use. So for this example, we're going to use cross cradle hold. So what you want to do is make sure that your baby is really close to you. So depending on the position of your breast and nipple depends on how you'll hold your baby. So you might have them, if your breast is quite high up, really close here, or if you've got larger breasts, then baby might be close further down here. But you want to just make sure that baby is tucked in really close to you. The next thing that's really important is that your baby's head is free to move, because we want to get that nice deep latch and baby needs to open their mouth wide. So in order to do that, we don't want to restrict their head. So you can hold the back of their neck like this with your hand, just providing some support but giving them free movement. We want to make sure that your baby is all in line and that they're not twisted. If you think yourself, if you're trying to have a drink and your head's twisted to one side, it'll be really difficult. So make sure that your baby is not twisted at a funny angle and that they're all nice and straight. The next thing that we want to do is make sure that baby is lined up appropriately. So you're always tempted to try and just pop baby on the nipple, but what we want to do is line your nipple up with baby's nose so that when the baby latches on, your nipple goes to the back of the mouth where the soft palate is. So if you think nose to nipple, then you're roughly going to be in the right place. It might mean that you have to pull baby's feet and bottom further round than expected to do this. The next thing that you want to do is make sure that it is sustainable and comfortable for yourself. So find somewhere comfy to sit when you're feeding, especially in those early days when you're still a bit uncomfy from delivery. And if you've got your positioning right, then hopefully good attachment should follow.